treatment of diabetic foot ulcer. I am pursuing my PhD under the supervision of Dr. Archana Das from CSIR-North. Now, I am going to the next slide. The aim of my talk is to propose a biocompatible, cost-effective, and biodegradable nano dressing. An objective of my talk is the understanding the challenges of diabetes mellitus and diabetic foot ulcer. Also, we also discuss the disadvantages of conventional treatment of diabetic foot ulcer and application of nanotechnology in DFU treatment and the evaluation of wound healing ability of silver nanoparticle in the diabetic foot ulcer treatment. Now I am going to the next slide. So diabetes mellitus is a chronic health problem. Excuse me. Diabetes mellitus is a chronic health problem that is prevalent among the human population. Diabetes mellitus is an endocrine disorder that is distinguished by the state of hyperglycemia, that is a decrease in or increase or decrease in sugar level in the human body. It is classified into two types, diabetes mellitus 1 and diabetes mellitus 2. Comparing the developed country and developed country, the diabetes mellitus is more, rate of diabetes mellitus is more in developing country due to the habitants of their ages and their population. And various problems are arises due to diabetes mellitus. Among them, the diabetic foot ulcer is the serious problem which causes huge socioeconomic burden in the society of developed country. We are trying to give a chart about the diabetes patient in 2019. In 2019, diabetes patient is estimated number of adults is 20 to 79 years. It is about 463 million. And it should be approximately in 2030, it is with 578.4 and maybe the 2045, it will be 700.2 million. I am going to the next slide. Please go to the next slide. Diabetic mellitus increases the risk of infection. The diabetic mellitus delays the wound healing due to the impairment of metabolic activity. Diabetic mellitus is a chronic wound that affects the lifestyle of patient and consequently heightening the risk of mortality. Worldwide, 9.1 to 26.1 million people with diabetic mellitus develop diabetic foot ulcer annually. Here we try to give the pathophysiology of diabetic foot ulcer. Please go to the next slide. Therefore, many conventional methods are used in the treatment of diabetic foot ulcer. Among them, the nanotechnology is an emerging field due to various applications in several areas. The property of nanoparticles give them a different application in different areas, like their large surface to volume ratio, electronic conductivity, biocompatible and biodegradable property, and the antimicrobial, anti-inflammatory, antioxidant, and other biomedical applications. Electrospinning is a convenient, cost-effective, and common technique that is used to produce the nanofiber. The nanofiber produced by electrospinning, it is a porous structure. Therefore, it helps in the healing of wound. It gives the oxygen to the wound, so that is, it accelerates the wound healing of diabetic patient. Here we use biodegradable polymer to fabricate the nanofiber. Among biodegradable polymer, cellulose is the most abundant natural polymer. It is found in nature. Due to its biocompatibility, renewability, and biodegradability, it has various applications. And among them, chitosan is the second most abundant polymer in the world. Due to its antimicrobial activity, if it is coated with nanofiber, it increases the antimicrobial activity of the polymer grafted nanofiber. And silver is, in long years ago, silver is used as an antibacterial agent in wound healing. In the form of nano, silver is the nano form silver is widely used in the wound healing application because it is a broad spectrum bactericidal effects. And again, we added a bio antimicrobial agent like plant extract, then it accelerates the antimicrobial property of silver nanofiber that helps accelerate the wound healing of diabetic foot ulcer. I am going to the next slide. The difference between normal wound healing and diabetic wound healing. The wound healing is composed of 4 stages. There are homatostasis, inflammation, proliferation, and remodeling. But in case of normal wound healing, 4 stages occur systematically. But in case of diabetes wound healing, it is delayed due to the imbalance angiogenesis because of an imbalance between the angiogenic factor like TGF-beta, FGF2, vascular endothelial growth factor, and other. And this infection put to the wound infected the wound due to the microorganism present in the wound, and it is lack of microcytosis and growth factor and essential peptide leads to amputation of the leg and cause it increase the mortality rate. Now I'm going to the next slide. The application of nanotechnology. The nanotechnology has tremendous application in several fields. Due to their biocompatibility, biodegradability, and renewable nature, nanotechnology are used in diabetic wound healing. Because nanofiber provide a moist wound environment, non-toxic and cost-effective nature, and several novel strategies have been incorporated for the hard-to-heal wounds. Among them, nanotechnology is the most applicable one. Now I am going to the next slide. Now I am going to the next slide. The wound healing mechanism of biomediated nanoparticle. Nanoparticle can be used in the wound healing of diabetic wound healing. Among the nanoparticle, biomedical nanoparticle is the most efficient one due to its eco-friendly and economically sound nature. When silver nanoparticle is coated with antioxidant polyphytochemicals, the reduction of oxidative stress has been observed, thereby accelerating the healing of cutaneous, surgical, and burn wound in a diabetic patient. Further, silver nanoparticle in photobiomodulation therapy is shown to be a positive effect of wound healing through stimulating angiogenesis and inflammatory response. The cellular process involved in wound healing by the biogenic silver nanoparticle as an electrospinning nanofiber. Now I am going to the next slide. We have done silver nanoparticle coated with cellulose. Here we discuss the antimicrobial activity of the silver nanoparticle. Now we try to discuss the mechanism of the silver nanoparticle. Due to the silver nanoparticle is most effective in case of gram-negative bacteria due to the difference in the cell wall of gram-positive and gram-negative bacteria. Because cell wall of gram-negative bacteria is consist of thin layer of peptidoglycan, but the gram-positive bacteria is consist of thick layer of peptidoglycan. And again, to the electrostatic interaction of gram-negative bacteria and silver-positive ion, there is a disturb in the permeability of the cell wall, and silver nanoparticle enters to the cytoplasm of the cell, and it produces a reactive oxygen species in the cell and is increase the oxidative stress in the cytoplasm, and it finally causes cell death by denaturation of protein and demetabolize the enzyme and also destroy the DNA replication and mitochondria. And finally, it causes the cell death. Now I am going to next slide. We have done the antimicrobial activity of silver nanoparticle against 4 harmful pathogens which are responsible for wound healing. We have determined the inhibition zone of E. coli, and in case of Staphylococcus aureus, Pseudomonas aeruginosa, and the fungi Candida albicans. It is seen that when the concentration of the nanoparticle increases, the antimicrobial activity increases. And in case of gram-negative bacteria, it is more effective than the gram-positive bacteria. So, the silver nanoparticle at lower MIC inhibit the growth of harmful pathogens both are that are responsible for wound infection in case of diabetic foot ulcer. So we can conclude that silver nanoparticle or electrospinning nanofiber can be successfully or efficiently used in the treatment of diabetic foot ulcer. Now I'm going to the next slide. Here we determine the MIC of silver nanoparticle. In case of Staphylococcus aureus, the MIC of silver nanofiber is 35 microgram per ml. In case of Escherichia coli, it is 15 microgram per ml, and Bacillus subtilis, it is 30 microgram per ml, and Klebsiella pneumoniae, it is 15 microgram per ml. And we also determine the mechanism of antimicrobial activity of silver nanofiber by determining the percentage of ROS generation and DNA membrane leakage. As the concentration increases, the ROS generation increases, and DNA membrane leakage also increases. We also determine the antioxidant activity of silver nanofiber by using DPPS test. Here we got the IC50 value of silver nanoparticle is 52.76 microgram per ml, and I also try to determine the anti-inflammatory activity of silver nanoparticle by using BSA assay. Here we got 67.52 IC50 value of silver nanoparticle, and we also determine the drug delivery activity of silver nanoparticle. Due to the use of cellulose, silver nanoparticle effectively loaded the drug. It is 37% drug loading capacity with efficiency 51%. So therefore, we will conclude that silver nanoparticle effectively deliver the drug, antibiotic drug that is responsible for healing purpose of diabetic foot ulcer treatment. Now I am going to the next slide. These are the remarkable work done in this school. The potential of silicon-based nanofiber mats for wound dressing application has been utilized for diabetic foot ulcer, and Y. Agaral et al. Also prepared curcumin-loaded polycaprolactone polyvinyl alcohol 6-1-based electrospun nanofiber for healing of diabetic wound. And M. Soduri et al. Also they have also studied the in vitro or in vivo to accelerate the diabetic wound by combination of silver nanoparticles as antimicrobial agent with calcium alypinate nanoparticle as homeostatic agent and fresh blood as nutrient growth factor supply and nitrogen as base matrix. Now I am going to next slide. Arsingla et al. Also prepared cytocompatible antimicrobial resin of cesium cellulose nanoparticle decorated with silver nanoparticle accelerate to acute diabetic wound healing. And a bioactive multifunctional heparin grafted aligned polylacticido-glycolido-glucamine nanofiber membrane was prepared to accelerate the diabetic wound healing. And this is the graphical abstract of this paper. And FCSIR et al. Also prepare and characterize a chemically tempo-oxidized and mechanically disintegrate saccharine nanofiber for enhanced diabetic wound healing. And M.R. Mohammed also prepared a excellent nanofiber matrix based on gram-tegafed poly E-caprolactam polyvinyl for accelerating the diabetic wound healing. Now I'm going to the next slide. Now, the advantage of electrospinning nanofiber in DAPO treatment. Electrospinning is a general, cost-effective, and biodegradable treatment to prepare nanofiber. In case of other antibiotic, there is some chance of side effect or secondary infection occurs in wound healing process. But when we use electrospinning nanofiber in the wound healing or in case of diabetic foot ulcer treatment, the porous structure of electrospinning nanofiber gives the oxygen to the wound healing and moisture, and their hydrophilic nature accelerate the wound healing. So it can be concluded by using electrospinning machine. We have synthesized a biocompatible, biodegradable, and cost-effective nanofiber composed of biopolymer antimicrobial agent. It is originated from herbal, it is plain extract, and a silver nanoparticle is an effective, ideal, and successful alternative in the DAPO treatment. I am going to the next slide. So conclusion and future perspective of my talk is that silver nanofiber is expected to be an alternative wound healing test to overcome the obstacle of traditional wound healing bandage. Biometric electrospun nanofiber wound dressing loaded with silver nanoparticle possess properties of dual antimicrobial and tissue repair system. Silver nanofiber is a comprising nanofiber membrane to improve the clinical efficacy of diabetic wound healing, which is expected to provide a basis for future development of material-based therapeutic. Nanotechnology remedies will possibly the next frontier for breakthrough in meeting the clinical needs of diabetic foot ulcer. Wound dressing pads will be synthesized in large scale for the industrial purpose that will help in the development of new technology. Therefore, at last, we have concluded that we should prepare a large scale this type of antimicrobial patch, which is a very fruitful for developing country because due to its cost-effective nature. Now I'm going to next slide. I am sincerely acknowledge my director of CSIR-North, my supervisor, and the organizing committee on second global webinar on diabetes and endocrinology and Department of Science and Technology Government in India for the funding and all my flatmates and at last my parents, siblings, and pom-pom. Thank you. I am going to the next slide.